Belgium healthcare. In Belgium, the healthcare system that they use is the Bismarck model. This system originated in Germany by the Chancellor Otto von Bismarck. It involves the use of an insurance system whose sickness funds serve as insurers and is often financed equally by employers and employees through payroll deductions. All working people contribute part of their income to a central fund, and if someone becomes sick, they can claim part of the cost back from this mutual insurance fund. These mutual insurance funds are still in use in many countries, including Belgium. The funds all work differently but operate on the same principles where you're free to choose your doctor, you pay for your treatment, and then get reimbursed for part of the expenses by your mutual insurance fund. Reimbursement rates can vary between countries as not every reimbursement system is the same. If you would like to receive full reimbursement for your medical expenses, then you may want to take on an additional private health insurance to fill the gap. The reimbursement also depends on the employment situation of the patient, the type of services provided, the act of the person who is socially insured, as well as the accumulated amount of charges already paid. In Bismarck countries, hospitals and doctors are usually private. The Bismarck model doesn't provide universal health coverage. It requires employment for health insurance, so it isolates its resources to those who contribute financially. So for further explaining, there's this video.
Sore throat, blocked nose, fever. Oh, it sounds like you're coming down with something. You need to find yourself a doctor here in Belgium. Ah, you found one. Great. Your worries are over. You'll be well taken care of. And the verdict is... oh, a good old-fashioned flu. So, off to the pharmacy it is. Hang on. Aren't you forgetting something? That's right. You need to pay the doctor after your visit. No, don't panic. You'll get your money back. You see, solidarity is one of the major traits of this country. And thanks to that paper slip the doctor gave you, you'll soon be reimbursed. Here's how it works. Every citizen in Belgium contributes to the healthcare system by giving part of their salary to the state. That part is known as social contributions. These contributions finance a compulsory insurance which ensures reimbursement of basic health services, such as certain medication and your visits to the doctor. To benefit from this reimbursement system, all you need to do is register with a Belgian health insurance fund, known as Mutuelle in Wallonia and Mutualiteit in Flanders. These funds are private organizations that reimburse parts of the money you paid for healthcare. They're also in charge of paying allowances in case of incapacity for work. But this compulsory basic insurance doesn't cover everything. You also pay a variable yearly contribution to your fund to cover a supplementary insurance, which pays for extra services, such as hospital care or your GP's house calls. Despite all of this, you could still find yourself in a situation where the basic and supplementary insurances don't cover the services you want and you'd have to pay substantial amounts of money. For example, if you want a private room in a hospital. Luckily, the fund proposes a whole range of optional insurances. So in short, if you go see a doctor, you pay him directly for the consultation. In return, you receive a receipt that you give to your health insurance fund. They will ensure most of the money is paid back into your account, so you only pay a small percentage of the cost. Crystal clear, isn't it? However, bear in mind that depending on your personal situation, legislation can vary. To find out which rules apply in your case, please visit socialsecurity.be.
Okay. Concerns within the Bismarck model. The primary issues that may come across the Bismarck model is how to provide a health care for those who are unable to work, unemployed, or can't afford contributions. This is because the Bismarck model provides services for those citizens that can contribute to the funds. This may include older populations and the imbalance between retirees and employees. The focus on low cost and efficient care means that there are less healthcare services available for people living in rural areas. The mandatory employment taxes are high in order to keep the healthcare affordable, and there are longer wait times for patients trying to receive elective secondary and tertiary services. Comparing Belgium to other Bismarck countries. Life expectancy. If you look at the life expectancy in Belgium, it is 79 years for men, which is a little higher compared to the average of 77.5. For women, it is 83 years compared to the average of 83.2. Overall, Belgium has an average life expectancy of 81 years. If we compare Belgium's life expectancy to Germany, another Bismarck model country, it looks the same. In general, in Germany, the life expectancy for men is 79 years and 83 years for women. Looking at the rates in France, women's life expectancy is 85 while men is 79 years. This number is also very similar to Belgium. In Japan, the life expectancy for men is around 82 years and for women it is 88 years. In the Netherlands, the life expectancy for men is 80 years and 83 years for women. Countries with the Bismarck model live long lives when looking at this information. The world's life expectancy is 75 years, so all of these countries are higher than the overall average. This also means that these countries under Bismarck model healthcare is pretty successful in terms of people having high life expectancy. Comparing to other Bismarck countries' cause of deaths. In Belgium, leading cause of death is cardiovascular disease 28.6% and cancer 26.3%. These are by far the biggest causes of death for the Belgian population. While the share of cardiovascular disease has decreased over the past years, mortality from cancer has remained relatively stable. Comparing these numbers to another Bismarck country, Germany has the same leading causes, cardiovascular disease and cancer. In Japan, the leading cause of death is cancer, with cardiovascular disease following after that. Stroke and Alzheimer's then come after that. France has cancer as its leading cause, then cardiovascular disease, and parasitic and respiratory diseases. The Netherlands have a leading cause of cancer, then cardiovascular, and then neurological disorders. And then looking at the infant mortality rates between the Bismarck countries. Looking at the infant mortality rates, which is the number of infants dying before reaching 1 year of age per every 1,000 live births given in a year, Belgium, France, and Germany have 3 deaths. This number has almost actually been cut in half for these countries within the past 30 years, which is good. In Japan, there's only 2 deaths, and in Netherlands, they have the highest rate of the 4 countries, which is 4 deaths. Overall, looking at this data, it can be seen that the numbers are fairly low for countries in the Bismarck model. Comparing the physicians per 1,000 people. For every 1,000 people, the physician number is 6 for Belgium, 6.5 for France, 4.3 for Germany, 2.5 for Japan, and 3.7 for the Netherlands. Belgium has one of the highest rates compared to the other Bismarck countries. Bismarck model countries seem to overall generally have more physicians. It is good for a country to have more physicians so that the numbers can keep up with the growing population. And ignore the 10,000 people. It's supposed to be 1,000 on the title. Okay, understanding cultural differences in Belgium. So looking at religion, majority of citizens in Belgium are Catholic, more specifically Roman Catholic. Second is no religion, and then Islam, and then Protestantism. 1% or less is Buddhist, Jewish, or Orthodoxy. That doesn't mean you should look over them, though. Understanding the diversity of religion in Belgium is a key factor of delivering the healthcare. Communication. In general, Belgians try to avoid confrontation with their communication style. They express themselves in a logical and reasonable manner. They tend to be more modest and simple in their interactions and speaking. They may still have some differences with Belgians, such as Southern Belgians might be more flexible and open, and some other people may have more open emotional expression. Understanding what communication works well with people will increase the care you give and make it more efficient. Language. The most common spoken languages are French, German, and Dutch. Some might also speak English. Understanding the language of people is very important towards the communication. You may have to work around a barrier and find solutions if you or the patient don't understand one another. And then respecting the cultural diversity. To reduce healthcare difficulties, cultural sensitivity is essential. It makes it easier to obtain high-quality medical treatment when you are responsive to the requirements of the patient from all backgrounds. When designed and put into practice, such as framework, cultural respect enables systems, agencies, and professional groups to work well to know the needs of people gaining access to healthcare and health information. Respecting the diversity of religion. Understanding religious beliefs is very important to healthcare. There are many different religions that have different ethical views and preferences. Many people seek comfort spiritually during health crises, and many people find their spirit in religion, which makes it so much more important to respect those religions. Some generally held beliefs among Catholic patients might include going to Mass every week. The sacrament of the sick administered by a priest is crucial for those who are ill. Artificial birth control is immoral, and abortion is prohibited. Transfusions of blood and organs are acceptable. This is just one example of the religion in Belgium. It is important to create an understanding for each patient's religions and respecting them. Ways of respecting religion might be asking them for preferences and listening carefully to their response and actually following through with their beliefs. They might have beliefs that contradict medical care. You should always explain what you are doing when working with them. Many people don't follow religion in Belgium, but that does not mean you shouldn't make any assumptions about that individual. They might still have specific beliefs outside of religion. It is important to still ask for preferences when handling with that patient. With respect, patients can build a foundation of trust and feel more at ease when they see their nurses and doctors. And then respecting cultural differences within communications. Communication is one of the biggest key factors in successful healthcare. It is important to understand how communication differs from person to person. When speaking to a patient, make sure you identify and ask what language they would prefer to communicate in. If the patient does not have a great understanding of the language you speak, get an interpreter. Get an idea of what communication style works best for each individual. Overall, the goal is to respect the different and preferred communication styles. Be willing and open-minded to advocate for one another. It also goes without saying that the communication space should always be mutually respected and constructive, a place where both sides will feel safe to share opinions and listen. And then one example of why it's important to communicate effectively and be clear and respectful is in this video.
And so you've had some experiences as a patient.
Yes.
Where you weren't understanding English at that time. Can you tell us a little bit about that?
Yes. So, unfortunately, when I was 4 years old, I got run over by a car. And at that time, I didn't speak any English. I just spoke Spanish. And so I spent 3 months in the hospital. And in my culture, you're supposed to tolerate pain. You don't ask questions. You give authority to the people that are caring for you, so the nurses, the doctors, and you just don't question. So one of my experiences is as the nurses were doing their interventions to move me, I was under a lot of pain. And I didn't know how to ask for, I didn't even know I had the choice to ask for pain medication. My parents weren't always there because they had 3 other kids that they had to care for. And it's not like we were making a lot of money, so they couldn't always be with me. So anyways,
And that memory has stayed very vividly with you, it sounds like.
And it's one of the reasons why I got into healthcare. One of the things, because I didn't find a connection with the nurses, I didn't understand what they were doing, or the physician. I didn't get it. All I knew, I was under a lot of pain. I knew there was an accident. They kept telling me what a miracle it was for me to be still alive. But that whole process, I still felt alone. So one of the things now that I'm in healthcare, and my purpose of being in healthcare is I don't want no one to experience that, regardless of their culture, the language they speak. Connecting with your patients in the most simple ways. It can be a touch. It can be eye focus. It can just, you don't really have to say much. And if you are interpreting with, have an interpreter line and really be honest and don't mask anything, because the people can, like me, even though I was a child and didn't understand English, but I can read people's energy. You can tell when someone's being dishonest. They have a certain look to them, and it's just just always be honest with your patients at all times. And even if you don't have the answers, say that. That's a great question. I don't have the answer. I'll have to look into that.
Okay, and respecting cultural differences overall. In Belgium and in general, keep a comfortable and professional distance between you and your patient. Respect space boundaries when talking. A comfortable distance is 18 inches between one another. This distance may differ within people, so if someone has a different boundary, remember to respect it. Respect the patient and don't spread rumors or discuss them with anyone that isn't involved in patient care. In Belgium, it is seen as respectful when addressing a person by name or title when arriving, leaving. Shaking hands is also seen as respectful. Cracking knuckles and yawning is seen as rude in Belgium, and patting someone on the back would be seen as disrespectful. And don't point a single finger at someone, it is also seen as disrespectful to the culture. And then these are my sources. Thank you.